All right, here we are in the knee joint, and this is the notch of the knee. And you can see this is a narrow notch, which is one of the reasons that females tear their ACLs more than males. So the first step of the procedure is called a notchplasty. It is taking the notch and widening it, so now we can see all the way to the back of the knee, and our new ACL will not hit that notch, which is why an ACL tears. Here we are with my 4.0 millimeter burr, and we're finishing the notchplasty. And again, it's very, very important to see all the way to the back of the knee, which is where the native ACL used to attach, so that we can put the new ACL exactly where it needs to go. So we have a nice wide notch, and I can see all the way to the back of the knee where it needs to go. And now we're ready to start our tunnels. The first thing we do is use a set of guides with very specific angles. You can see the crosshairs, the laser marks in this guide, and I have a drill coming from outside of the knee, and it comes up into the knee. This is called a cannulized system, so we have now a reamer that's coming over our first drill bit, and this is a 10 millimeter reamer creating a 10 millimeter tunnel in the tibia. The little rasp created a nice smooth edge, and now we're going up to the femur. Again, we have a guide bringing us 7 millimeters forward. This makes sure that I have 7 millimeters of space so that I don't have my ACL being rubbed by that notch. We have a 10 millimeter reamer creating our femoral tunnel. Now this pin has passed all the way through both tunnels, and it guides our graft, our new ACL, up. You can see the bone plug sliding up into the femoral tunnel. Here's our new ACL. Looks very, very nice. It's nice and snug and tight. It's not getting hit on by the notch towards the outside. And then we place a 7 millimeter by 25 millimeter screw in the bone tunnel. You can see the screw head up there now, and it's crammed into that tunnel, a 7 millimeter screw, a 10 millimeter bone plug. And now we place a screw in the tibial tunnel as well. We test the ACL, make sure it's not being hit on any side. I'm now bringing the leg into extension or coming out into a straight position. And again, just making sure that there's absolutely nothing impinging on that new ACL, so it's nice and protected and can heal beautifully.